Cold sterilization. You're going to need a receptacle in order to be able to sterilize your instruments in a liquid. We have the Bard Parker sterilizer tray. It's a glass container receptacle. It has a nice metal lid and it does have itself a little tray here for you to lay your instruments in. When you place instruments in the tray, they do need to be open. The ratchet is not engaged, and that way that the solution can get into the striations. For a sterilant, we're going to be using some supergermaphene. Supergermaphene in the right concentration is an ideal sterilant as long as the instruments are immersed for at least 20 minutes. If you change the solution in the morning before your surgery, just make sure that you do have 20 minutes time before the instruments are required for use. If you're going to dilute supergermaphene, you're going to want to make sure that you have a container and you're going to want to make sure that it's labeled properly to WMIS standards. So what we have here is what once contained distilled water. We've completely removed the old label, keeping with WMIS standards, and we've added a pre-printed label. There are labels like this found in the building. If there are none in the student work area, please let a technician know and you can be able to gather one from their office. And it does read diluted supergermaphene. It'll also explain to you the concentration, but you should know it by heart, and what you are going to find is you need 25 mils of the supergermaphene into 2 liters of water. This container here already has a little bit of solution in it, but what I found is it's not enough to adequately cover all my instruments. So I'm going to add a little bit more. I'm making sure that the solution is clear. There's absolutely no flocculants in there, so I know that it's still clean and still able to do its job. I'm going to add just a little bit more water. The trick is to make sure that once the solution has been added, I said water, it's actually solution. Once the solution is added, it's not going to come to the top of the tray when the tray is resting on its lift. There is a lift mechanism inside the glass so that the tray can rise and extra solution can drip free from the instruments. I want to make sure that I have that space. And then I want to make sure I have enough solution, so I'm going to lower my tray back into the receptacle and I can see that all my instruments are adequately covered. So I can close the lid, I can let it rest for at least 20 minutes, and I know that these instruments will be sterile for use. What I want to do is I want to make my notation on the cover of the date that I changed the solution, so that if in 7 days the solution hasn't been used and it hasn't been changed, somebody will know to change it anyway. The second receptacle that we use that requires supergermaphene in the diluted formula is our transfer forceps. Now our transfer forceps are a tool that are designed for non-sterile personnel to be able to manipulate sterile objects. It would be an extension of the hand. So I'm not sterile. That instrument is supposed to be sterile after 20 minutes, of course. So in order to reach it, I would use my transfer forceps. We do have a supergermaphene solution inside this container. In order to fill it up, what you want to make sure is that your supergermaphene is going to rise at least to this level, so within an inch of the top rubber seal of the handles of the transfer forceps. You would use the same concentration, which is 25 mils of supergermaphene to 2 liters of water. You could lift up the lid, slowly pour some in until you're sure you have the right level, and close it. Once these are full, again, they're good for 7 days in the same solution, provided that there's no dirt or debris found floating inside the solution. As soon as you see dirty solution, please change it. What I would want to do is take a tape, a label of tape. It can be masking tape. Sometimes people use bandage tape, which has a really good sticking quality to the metal. And you're going to want to write your date, your name, your group number, and changed on, so that everybody knows why you've written on the label, but that the solution was changed on that date. And that's all there is to it.